Thank you for joining us. Good afternoon. I'm going to talk about uterine fibroids. The theme for today is to cut or not to cut. So, we are looking at, as part of a vascular interventional center, we are talking about the procedures, the minimally invasive procedures as options to the standard treatments that we are aware of. So, I'm going to talk about some of the relatively newer procedures that are available for treating, it's a very common condition of fibroids. So what all do we offer as an alternative to the standard treatment of surgery, which is either a hysterectomy or a fibroid removal with myomectomy? So before we start, I would like with a polling question. Have you anybody of you heard of embolization? Yes, I know, and no, what's that? You can see on your slide there is this uterus with a yellow color showing a fibroid in the muscle wall of the uterus, and we are injecting some white to blue things, which are the particles to block up the fibroid. This is what I'm going to talk about in a short while. Okay, so we have any answers for the polling question? Okay, so let's talk about. The answer is no. So just to brief you a little bit about embolization, it's been a procedure which has been there for many years. I would say I started as a trainee in 1998 in the UK, and even in 2001, we were doing a lot of embolization procedures to treat uterine fibroids, as much as 2 to 3 patients every week. This is in early 2000s till up to 2004. This was only one site in the UK, so it's a very common procedure which is quite much more popular in the West, not so common in this part of the world, mainly because of less awareness amongst the general population. So let's go ahead. We talk about fibroids. A quick recap. You can see the picture on the screen. You can see a uterus, the ovaries, and the fallopian tubes. And you can see fibroids. There are multiple fibroids of different shapes and sizes, which is the most common scenario we see in females in the age group of 35 to 50 years of age that we come across in our practice. So they are basically muscular growths in the wall of the uterus. They're almost always non-cancerous. So usually, most of the times, they are not cancerous. They're just benign growths. They kind of grow as females in the reproductive age gets older. Mainly in the commonest age group that we come across them is in the age group of 35 to 50 years of age. Now, usually we can leave them alone, but sometimes treatment is needed if they cause things like heavy periods, heavy bleeding, anemia. They are big enough to disrupt uterine function and interfere with pregnancy. Now, what are the common symptoms? As we heard, you can have heavy bleeding, you can feel anemic symptoms because of heavy bleeding, because of low hemoglobin, exercise intolerance, get fatigued easily, and things like that. So what's a uterine fibroid embolization? So as you can see on the screen, it is a minimally invasive treatment which involves access through with a 2 millimeter incision in an artery in the groin. Nowadays, we can also do it from the radial artery in the hand. It's just a 2 millimeter incision, go through into the blood vessel, reach the fibroid through the highway of the blood vessels, kind of back wall of the fibroid, and through the blood vessels you block the blood supply to the fibroids specifically, and that is how you treat the fibroid. So this is called fibroid embolization. So minimally invasive treatment to cut off the blood supply to the fibroid so they become smaller in size, they shrink over a period of time. So as I mentioned, a thin tube is inserted to supply the fibroid. This is navigated using X-ray fluoroscopy. Small particles are then injected permanently into the fibroids very specifically. They cause the fibroids to shrink over a period of about 3 to 6 months. So the effect is not immediately available. Like, you won't expect that you do today, but tomorrow you will have a fibroid gone. So it would take some time, but it's a very durable. And the best thing is it treats all the fibroids. You can treat all the fibroids at the same time rather than going after each one of them. And the whole process is fast, minimally invasive, and takes about 45 minutes to do. Now, who's the best candidate? So this is, I've been doing this for almost 2 decades. So I'm telling you about based on my experience who's the best candidate for this. It's best for females with heavy bleeding, menorrhagia. They have low hemoglobin. As you know, most females, normal females, will have hemoglobin above 11.5, 12 grams. But many times females have heavy bleeding every month and the hemoglobin is lower. So you can have somewhere around 8, 9, 8 to 10. A lot of them will have symptoms. Get tired easily, get fatigued easily, exercise intolerance is there. So these are the common features of anemia, means low hemoglobin. So these are good candidates for fibroid treatment. There are pressure symptoms. For example, a large fibroid, for example, a 5 centimeter fibroid is pressing on the urinary bladder. You have to keep going to toilet many times a day, and each time you go, there's no sense of complete evacuation of the bladder. Sometimes you can have constipation because of pressure on the rectum. And it's best for females who are over the age of 40 years. And we know a lot of females fall in that category because, as we know, most of the times fibroids will be there in the age group of 35 to 50 years. So what can you expect from UFE? It's a minimally invasive procedure. It is an alternative to open surgery. Uterus is preserved. It's done through a 2 millimeter incision. It is done, we do as a day surgery procedure. Majority of the times patients go home same day. There is some discomfort, but it's very well controllable. And you can be back to normal activity in 2 to 3 days. Now, one of the most important things is it is not a treatment, like everything, like you have fibroids, multiple, it's a complex issue. So not everybody is suitable for the procedure. There would be some patients who would be suitable for medical treatment, some patients who will be suitable for surgical treatment, some patients who would be suitable for minimally invasive treatment. So each patient varies with different treatment offered depending on the type of disease and the type of symptoms the patients have. No, how do you know whether you're suitable? So of course, the way is to, if you're, we're looking as a ballpark figure. If you're a woman above 35 years of age, want to avoid invasive surgery. Many times we don't want to go for an open operation or even a laparoscopic operation. No plans to get pregnant in future. Although there was an article last year which said you can have much higher fertility rates after embolization than quoted. And there are no big trials, but this was quite a large study with a significant number of patients. So there are more trials and studies being done to see which patient is the most suitable. As we know, everyone is different, so their medical conditions and presentation and what you need as a treatment is different for every individual. So best is to consult with your doctor or gynecologist. So like with everything else, there are some potential side effects. No procedure is perfect. We are looking at 1% risk of infection. We are looking at 1% risk of bleeding from the groin or from the radial artery. You can have transient menstrual irregularities. I have had patients who I have treated and they say, oh, my period came a bit early, or my period came in the mid cycle and it lasted for a couple of days. So you can have some of these irregular menstrual issues which are usually transient and resolve in 2 or 3 months maximum. Some people can get premature menopause, but it's a lot of it's technique dependent. Once you get good at it and once you get experience, you know what to do to avoid this condition. Just like you have a surgical, it depends. You have to find a good surgeon to operate. Same way, you need to find someone who's experienced to avoid these complications. Some patients may experience cramps and pains for 24 to 48 hours, and this is usually managed with medication quite well. So that's my last slide for fibroid embolization. Um, any questions I would be happy to answer at the end of the session.